Greetings, hello, and welcome to Ask Dr. Bill, a series of conversations with Dr. Bill Takeshita, answering your questions about children's vision. I'm Tori Schladen. I'm the Executive Director of Partners for Pediatric Vision. Dr. Bill Takeshita is our consulting optometrist and parent educator. Dr. Bill, we have lots of questions from parents all the time, and today I want to ask you to explain a little bit about what is a pediatric low vision exam.
Oh, well, that's a very good question. And the reality is that we very rarely are asked, what is the difference between a pediatric low vision examination and a regular eye examination? Well, in general terms, we do know that there are actually two different types of eye doctors. There are ophthalmologists, who are medical doctors who are specialists in diagnosing eye diseases and performing surgical or medical treatments for these visual problems. There are also optometrists, and optometrists specialize in the diagnosis of eye conditions, and we also use a wide variety of tools to treat visual problems. Optometrists may go into specific specialties such as pediatrics, and they may also go into further specialties such as pediatric low vision. So that was my specialty. And so what that means is that the children that I would examine were children who do not have normal vision. There is something wrong with their vision that cannot be corrected with glasses or medications or with surgery. And as a result, these visual problems affect their ability to perform daily activities.
In what kinds of situations do you recommend that a child receive an exam from a low vision optometrist?
I feel that any child who has a visual condition that cannot be corrected with glasses and surgery really should be seen by a pediatric low vision optometrist. In our case here in Los Angeles, the majority of the children that we examine are actually referred to us by the ophthalmologist. So if you live in a town and you're not familiar, if there is a pediatric low vision optometrist, you really want to ask the ophthalmologist. And these types of examinations should be performed usually once each year. During the low vision examination, it's very different than the regular eye examination. For example, we don't necessarily use eye drops so that we could see inside of the eye, but we actually measure all of the child's different visual skills. How clearly can they see? What's the farthest distance that they could see clearly? What types of colors can they see, or what colors can they not see? How does glare affect them? Many kids with low vision are very sensitive to the bright light, while other kids have very poor night vision, and if they do not have enough light, they function like a person who's totally blind. So once we measure all of these different visual skills, we will then try to design different visual aids that can help the child to see whether it's color or whether it's going to be in the bright sunlight or if it's going to be in a darkened area. We have many, many different types of visual aids, and we also have a lot of computerized technology now.
So when you are mentioning visual aids, are those things like magnifiers and telescopes, and can you describe a few of those visual aids that benefit children with low vision?
Yes, you know, those types of things such as the magnifying glass that someone would hold to look at a book and telescopes that are very small, but they allow a person to focus far. They were very, very popular in the 1970s and the 1980s, and we still use them today. The technology of them have improved so that children and adults with low vision will have even more vision. But we now find that there are electronic magnifiers which can literally focus on the page, and you could make it larger so you could read it with your own eyes, or you could press a button and the magnifier will read the words out loud for you. So for a person such as myself who's totally blind, I could go to a bookstore and I can take the magnifier, press a button, and it will read it out loud. It's just fantastic.
Great. It really, it levels the playing field, as they say, which is really
so much
for the families that we work with.
Yes.
Maybe one last question, and that is, can you just talk about the information that's shared? You sort of touched upon it as far as recommendations, but maybe who receives that information or how that information can be used to really help the child?
Yeah, when we finish our evaluation, the low vision examination, we do write a comprehensive report. And this is very, very important that this type of report is written so that the parents could refer back to it, or they can share it with the child's teacher. And if the teacher knows that this child cannot see the color red, the teacher may modify the different types of dry erase markers that he or she will use. Or if they're going to do PowerPoint presentations, they may actually prefer to make it just in black and white for the child with low vision. So all of this information that's in the report is helpful to the parents, the teachers, the tutors, the coaches, the piano teachers, everybody who ever works with these kids. And as year after year passes, we actually can see how these children's vision may either improve, because it is possible that a child with low vision, their vision may improve. In other cases, it may be that their vision is decreasing. And if we do find that it is improving or decreasing, we can make modifications to the types of visual aids we use. So it's just truly one of the most enjoyable types of professions I think anybody could go into is pediatric low vision.
I agree. Well, I've been lucky enough to work alongside you for many years, Dr. Bill, and I have to say the other note about these pediatric low vision exams is the fact that families leave with hope. And that's a very, very powerful component to this unique experience that families get at a low vision exam. Well, we will wrap it up here for today, but please reach out to Dr. Bill, to me through partnersforpediatricvision.org. That's an easy way to get us, partners for FOR, pediatricvision.org, or you can give us a call. It's 323-612-8185, and we'll be back with another conversation very soon. Thanks, Dr. Bill.
Oh, thank you, Tori.